express during the morning at work, a short for comfort pumping, a full pumping at lunchtime, and another short pumping in the afternoon. If you are working less than 4 hours, then you can breastfeed before work and then again when you are at home with baby. If you are working 4 to 6 hours, express once, 2 to 3 hours after each feed, therefore decreasing the feeling of fullness and making it easier for the baby to latch on later. Delaying expressing more than 4 hours can lead to engorgement, a blocked duct, or mastitis. As long as you are expressing milk, there will be a supply. Expressing in the morning is easier because of the breasts being fuller and you are feeling more rested than in the evening when your supply may be lower. Basics of expressing breast milk. Expressing and pumping are learned skills, and the effectiveness of these skills improve with practice. Factors that influence pumping. Whether you are able to stimulate your letdown or milk ejection reflex, how long it has been since you last breastfed or expressed, how practiced you are at expressing, how comfortable you are in the setting where you are expressing, the time of the day, your milk supply, stress and its effects on you, choice of nipple fittings, and the ease of use of the breast pump. Understanding the letdown reflex and expressing. The letdown can be psychologically conditioned as well as physically stimulated. For example, some mothers let down their milk when they hear a crying baby or even at the thought of their baby. Because the sensations of pumping and hand expressing are not the same as the sensations of feeding a baby, especially at first, you may need to encourage your letdown using some of the following methods of physical and psychological stimulation. Express milk in a familiar and comfortable environment. Minimize distractions, so take your phone off the hook, turn on some relaxing music, and have everything ready that you may need, such as a glass of water or juice, a nutritious snack, or something to read. Follow a pre-expression ritual. Use a rhythmic motion while expressing to mimic a baby's suck. Focus all your senses on your baby. For example, have a photo of your baby nearby, a blanket to smell, or think of your baby snuggled close to you. If you are with your baby, express with your baby close by or while you feed on the opposite side. During milk expression, stop a few times to massage the breast. Switch breasts when the flow lessens, expressing from both breasts several times during each session. The breast is never empty, unlike a bottle, and milk is being constantly produced 24 hours a day. The technique of hand expressing. Wash your hands thoroughly. The letdown can be assisted by massage stroking and leaning forward and shaking the breasts. Position the thumb and forefinger about 2 to 3 centimeters behind the nipple. Push straight into the chest. Roll the thumb and fingers forward as if making thumb and fingerprints at the same time. Repeat rhythmically. Rotate the thumb and finger position to empty all parts of the breast. To avoid damaging delicate breast tissue, be aware of not pulling, squeezing, and sliding motions while expressing. Expressing should not hurt. The technique for using a breast pump. Wash your hands thoroughly. Using a breast pump takes practice. You may need several attempts at using the pump before you feel you are confident with it. Choose a time when you are not rushed and won't be interrupted while using the pump. Make sure all equipment for expressing and storing milk is washed, rinsed, and sterilized. Correctly assemble the pump and make sure that it is working before you use it. Ensure that you are relaxed and sitting in a comfortable chair before you start. Try leaning slightly forward, using cushions to support your back. Place the funnel of the pump firmly against the breast and initiate a gentle, frequent suction. As the milk lets down, gradually increase the vacuum and reduce the speed. The nipple must be comfortable in the funnel of the pump. Some mothers need bigger or smaller funnels. The correct size gives more milk and greater comfort. Be careful that too much pressure from the pump could crack or damage the nipple, so be aware of the time spent expressing so as to avoid this happening. Putting a pump on max can cause nipple damage. The pressure control is for comfort only. The maximum setting does not get more milk out. Pumping, like breastfeeding, should not be painful if done correctly. Some breast pumps have a feature that could control the amount of pressure applied to the nipple, which helps prevent damage to the nipples. Remember to stop the process if the nipples become painful or uncomfortable. Consult with a breastfeeding consultant in this case. The breast pump should be re-sterilized before each expression. When to use the pump? Early in the morning when the breasts are fuller, or just after the first feed of the day. After a feed if the breast still feels slightly full or uncomfortable. Between feeds, or at a break when you return to work. How to work out how much to express for your baby's feed. As a rough guide to give you a place to start, take your baby's weight in kilograms and multiply by 150 ml of breast milk. Then divide that over a 24-hour time frame. For example, a 5 kilogram baby multiplied by 150 ml per kilogram divided over 24 hours at 6 feeds per 24 hours equals 125 ml per feed. So remember, this is only an approximation. Every baby is different. Storage and handling of breast milk. When breast milk has been expressed, it appears to separate in the container. The milk has a blue tinge to it with a fatty layer on the top. Once the milk is swirled to mix it together, the milk looks like the familiar white color that we all know. This does not mean that the milk is old, but shows the fat content of the milk that is so necessary for your baby's health. Colostrum, which is milk expressed within 6 days of delivery, can be kept for 12 hours at a temperature of 27 to 32 degrees Celsius. For mature milk, 15 degrees for 24 hours, 19 to 22 degrees for 10 hours, or 25 degrees for 4 to 6 hours. Mature milk can be kept in the fridge at 0 to 4 degrees for 6 days. In the freezer compartment for 2 days, self-contained freezer for 3 to 4 months, deep freezer minus 19 degrees Celsius for 6 months. Freezing milk. Freshly expressed milk can be added to already frozen milk if it is cooled first and there is less fresh milk than frozen milk. After expressing the milk, allow it cool for half an hour before mixing with frozen milk so it doesn't thaw the top layer. Once the breast milk has been thawed, it can be refrigerated for up to 24 hours. Do not thaw or warm up milk in a microwave. Rather leave it to thaw at room temperature. Defrost in a fridge overnight or under warm water. Traveling with breast milk requires an insulated container and a big enough ice pack to keep it cold. Always discard milk left over at the end of a feed, so use small amounts to start with to prevent wastage. Dad's involvement in breastfeeding. Breastfeeding is a new experience for you and your partner. It is a learned skill and will need the support of those around you. Dad can get involved with baby by helping with bath time, doing baby massage, or just by playing with baby. Winding the baby after a feed is a task most dads enjoy and find rewarding to do. Mom may need time to practice the art of breastfeeding the baby. She may need help with positioning cushions whilst she feeds, or simply having someone to talk to about her worries with whilst she feeds. Encouragement at this time is vital for her, especially in helping the production of milk, because the support and encouragement you offer will lessen anxiety and stress and positively impact on the milk production. Babies need time too to get to know the breast. In the first days following the birth, the baby is quite lethargic and may not seem to be very hungry. The mom may become frustrated with the situation because of the breast filling with milk and needing to be relieved. The baby can still be put to the breast every 2 to 2.5 hours to practice the skill of breastfeeding, even if he doesn't seem interested in feeding at the time. This will also help with the stimulation and production of milk initially, and will lessen the chances of the breasts becoming engorged. Once the fatigue of the birth wears off, then the feeds will become longer in duration. Breastfeeding in public can be a real concern for fathers. Fear of the mother accidentally exposing herself in public can cause anxiety in Dad. Most mothers are nervous about breastfeeding in public too, but with a little practice and help from Dad, she can feed in public without anyone noticing. As a result of the adjustment of the mother's body after birth, as well as the lack of sleep, she may lose interest in sex. Remember that there are alternatives to having intercourse and showing your love for her, like a kiss, a hug, or holding hands. Due to the changes in hormones, the vagina may not be lubricated enough for intercourse. There are some products available to help the mother with the situation. Breastfeeding provides a protection against falling pregnant again too soon. If your baby is under 6 months old, your periods have not yet returned, and all your baby's sucking needs are met at the breast, day and night, you are unlikely to conceive another baby during this time. Certain forms of contraception taken during breastfeeding could be contraindicated. The recommended forms of contraception could include the mini pill or the breastfeeding pill, condoms, or the intrauterine device, although this does have its risks. As a couple, you should discuss the contraceptive options available with your doctor or health caregiver and decide what method would be suitable for both of you. Other ways in which you can be supportive to your partner include the following. Be available for answering telephone calls when mom is breastfeeding. Bring baby to her at night when baby wakes for a feed. Show your support by verbally encouraging her, especially when other people ask questions. Prepare her a snack or a drink while she's feeding baby. Play with your baby. And most importantly, give your partner a hug every day. Breast milk saves lives. Did you know that 30 ml of breast milk a day could save a baby's life? South African Breast Milk Reserve is one of the charitable organizations that bring donor breast milk to babies born in distress and that find themselves in the care of neonatal intensive care units. Babies born prematurely are at high risk of contracting an infection known as necrotizing enterocolitis, NEC. NEC is an acute inflammatory disease occurring in the intestine of premature infants, causing extensive necrosis and ulceration of the bowel. NEC often leads to death. NEC appears to be associated with the initiation of artificial feeding. Human milk, whether mother's own or a donor, has been shown to provide protection against many of the known risk factors of this disease. The Breast Milk Reserve provides breast milk to premature babies in the care of both public and private health facilities. So your donated breast milk can save the lives of babies that are not yours. There are breast milk banks in the major centres of South Africa. If you would like to become a donor, please contact South African Breast Milk Reserve at 082 700 0409 or www.sabr.org.za. Cape Town, Milk Matters on 021 659 5599